Hello everyone, this is Dr. Shushma Sarila, consultant homeopath at Fidicus Homeopathy. Now let's dive into the types of eczema so that you will have a better understanding if you're suffering from eczema, what kind of eczema are you truly suffering from. So let's dive in. First one we are discussing is called as atopic dermatitis, which is most common type of eczema. So what are the causes of atopic dermatitis is that if you have a family history of hay fever or asthma, that means you have every chance, 50% high risk of suffering than normal individuals. So what are the cause? Family history of having asthma or hay fever, and not only that, if you have any allergic triggers or if you're having maintained stress, then this can also cause atopic dermatitis. But remember, if you're having a family history, it is a super added risk upon stress and also upon the environmental triggers. So let's know in detail what is the presentation of atopic dermatitis. Cause is family history, allergic triggers, and not only that, stress. So if you can see here, the skin is very dry, which is the classical feature of eczema. It is red in color or inflamed, which is another classical feature of eczema. So what you will see here in atopic dermatitis, it is usually the presentation is large. If you can see, it is not pertain to a small spot. The distribution is large, and not only that, it is dry in nature, it is desiccated, the skin is red, and also there is a lot of scratching which will cause bleeding. Okay, so what is the presentation here? In atopic dermatitis, you will see a lot of itching. So the primary presentation of every eczema is dryness. If you keep that aside, itching is more prominent in atopic dermatitis. If you have any allergen, then the skin will start itching, it will become dry, desiccated, and it will start to bleed. And also if you have stress also, it will come. If you have any genetic predisposition to hay fever or to asthma, your skin will tend to become red, dry, desiccated, main importantly itching. Next, coming into contact dermatitis. So this is the second most common type of dermatitis. So what happens is, if you're allergic to any sort of thing, like if you're allergic to hair dye, then you will start having reaction near your scalp area and also on the forehead area. If you're allergic to metal, some people are allergic to metal, so if they have a ring on the finger, then there is allergic reaction surrounding that part wherever it is covered. Okay, if you can see here, the person is allergic to metal, so there is a reaction along the place where the person has put the ring. Remember, atopic dermatitis, there is a lot of itching. Contact dermatitis, there is a lot of burning sensation here. So the person will experience wherever he has come in contact with the allergen. It can be even soaps also. If you're washing your hands and then you're feeling some burning kind of sensation, dryness, and little bit of itching, it is maybe because of contact dermatitis. Some people have allergies to soaps, especially soaps which are used for cleaning clothes, soaps which are used for cleaning utensils, and also detergents. Some people are very allergic to wool, and also some people are allergic to metal. Contact dermatitis, if you remove the trigger, usually it will subside, but the internal immune disturbance which is caused cannot be removed. It can only be removed through homeopathic medication. Now let's dive into the third part of eczema, third type of eczema, which is dyshidrotic eczema. As you can see in the picture, this is also the third most common part of eczema. If you can see the fingers and observe clearly, many people will be having small kind of blisters which are fluid filled or serous filled, especially in this area. So here we have given a bigger picture. As you can see, there are small bumps which are fluid filled, which are small blisters. So what is the causation for this dyshidrotic eczema? If your hands are very sweaty, so this is associated with dyshidrotic eczema. And not only that, even if your hands are sweaty, remember the sweaty hands will always represent a stress or anxiety in the person. So people who are having chronic anxiety issues or stress issues and who are having sweaty hands will have this dyshidrotic type of eczema, especially on the hands. And also people who are suffering from vitamin B complex deficiencies are a super added thing to this dyshidrotic eczema. Remember that here in this type of eczema, there is itchiness associated. In contact dermatitis, there is less itchiness and more of burning, whereas in atopic dermatitis, there is more of itchiness rather than burning. Here in dyshidrotic, there is a lot of itchiness. Next, coming into the fourth type of eczema, which is nummular eczema. If you can see this, it feels like a ringworm infection. So what are the main differences between a nummular eczema and a ringworm infection is that, remember, here there is redness, there is dryness, and it is equally spread. Okay. But in ringworm infection, if you take, there will be centrally, there will be clearing. Okay. So the central part is always cleared and the edges are always very much inflamed or red in color. Okay. And the spreading is also outward. So the inside part, whenever if you see in a ringworm infection, is always clear. But if you see a nummular eczema, there is overall same pattern. There is no clearance anywhere. That is nummular eczema. That is how you differentiate between a nummular eczema and a ringworm infestation or a ringworm affection just through looking. Okay. So what are the causes of this nummular eczema? In people who are having genetic predisposition, even a small insect bite can cause this nummular kind of eczema. See, atopic dermatitis is very widespread, whereas nummular eczema, it is round in shape and also there are spots. Okay, so the spread is usually in the area where the insect has bitten you. Now, the other kind of eczema, which is seborrheic dermatitis. So, what's seborrheic dermatitis? It is eczema of the scalp, where because of certain irritations like dyes, it can be shampoos or it can be filaggrin gene mutation or genetic predisposition. There is redness, as you can see, not only on the scalp, there is redness and dryness on the forehead, on the mustache area. So remember, wherever there is hair on the face or on the scalp, this seborrheic dermatitis can be affected. Like for example, even this eyelid area also can show seborrheic dermatitis. How do you differentiate seborrheic dermatitis from dandruff? See, in seborrheic dermatitis, the skin or the part which is suffering from seborrheic dermatitis is very leathery in nature. Okay, whereas in dandruff, you do not see that leathery appearance. In seborrheic dermatitis, you can see hyperpigmentation in certain areas, but it is not found in dandruff. And also seborrheic dermatitis, if you are putting any sort of shampoos, anti-dandruff shampoos or any sort of anti-dandruff treatment, it will flare up, but it is the opposite in dandruff. Now, the next kind of dermatitis, which is stachys dermatitis. If the person is suffering from diabetes from a longer period of time or varicose veins, stachys dermatitis is most likely to appear. So what is stachys dermatitis is, the blood will start pooling in the lower part of the body, that is the lower limbs, and also there is no proper pulling up of the blood into the heart. So there is, if you can see here, the blood will start pooling down the ankle and there will be micro problem, that is micro disruption in the capillaries near the leg because of there is pooling. Okay, and that will release little bit of blood into the tissues, which will cause reaction, and that will cause stachys dermatitis. So stachys dermatitis is 99% found in the limbs itself, and also it is because of varicose veins or because of diabetes mellitus, which or because of genetic predisposition. But diabetes mellitus and as well as this varicose veins are the 90% causes of stachys dermatitis. What do you see here? You will see dry skin, you will see red skin, and also you will see scratching, and also you will see bleeding because of that scratching. So it is found in the lower limbs, and if it is left like this, that can lead into ulcer formation. So the prognosis of stachys dermatitis can lead into ulcer formation if it is not medically treated. Coming to the consultation part here at Fidicus. Here at Fidicus, if you are suffering from eczema and you would like to get in touch with us, we have two types of options, online and offline. Here in online, we have audio consultation as well as video consultation. If you are staying far away from the nearest branch of Fidicus, you can get in touch with us either through online call, that is audio, or video call. If you have any sort of investigations, you can share it with us. After doctor consultation, we will be delivering you top rated high medicines to your home, that is door delivery. If you're staying here in India, it will take at least 3 to 4 days for the medicines to reach you. If you're staying in USA, it can take up to 3 to 5 business days to reach you. or anywhere apart, it can take 4 to 8 business days to reach you. If you're staying near the nearest branch, you can come and visit us in person. If you're suffering from eczema and you want to cure eczema, you can contact us through this given number, either through WhatsApp, call, or you can ping us in message. If you're suffering from eczema and you want to cure your eczema, then why should you opt for Fidicus Homeopathy? Here at Fidicus, it is highest chance of health, and we follow 3 important principles. First is the given highest success rate that we experience, and also the transparent treatment. We will be giving you or the notes of the progress of the disease, how your disease is, and we will be educating you on it. And not only that, the personal care here at Fidicus is top notch. If you want to choose homeopathy, try Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.